Over here, we're on what side of the heart? Thin wall. Right hand side. I know you can tell by looking at it that you're on right because the person's facing you. But this is the right hand side. We got a thin wall. The valve on between the ventricle and the atria on the right hand side is the tricuspid valve. If you don't like that word, it's the right atrioventricular valve. If you don't like that word, it's the right AV valve. I don't know how the test bank's going to write it, so I would learn all of them. I like tricuspid because it tells me what? There's 3 flaps. 1, 2, 3. It has 3 flaps on it. And I've seen them in real hearts, there's 3 flaps. And that sheep in your lab, it has 3 flaps. And your dog at your house, it has 3 flaps. Mammals have 3 flaps on the tricuspid valve. This one's kind of cut away just so you can see inside. Okay? If you're describing it, the tricuspid valve is a 3-flap valve between the right atrium and the right ventricle. What does it do? In lab, you don't care what it does. You just label it. What does it do? It stops blood from back. You can say that same definition for that one. But they stop blood from back flowing. Do they work perfectly? No. Everybody has some kind of heart murmur. I've never seen any kind of X-ray. I've never seen any kind of sonogram that has perfect non-block. It's a piece of flap. There's nothing special. And the little blood flows through all the time. The tricuspid valve stops blood from back flowing from the right ventricle back into the right atrium. I don't want my blood all to go back where it came from, so that valve stops that. It's nothing technical. It's 3 little flaps of fibrous tissue. It doesn't have a brain, doesn't know when to do anything, it just does it by the way because it's there.
It has 3
cusp or flaps. 3 flaps. So 3 tricuspid valve. That would be a cusp. That's one or a flap. All right, let's talk about another valve. On the other side of the heart, in the left ventricle, you have the bicuspid because it only has 2. If you don't like that word, it's the left atrioventricular valve. If you don't like that word, it's the left AV valve. If you don't like that word, it's the mitral. I've heard it all of those. I don't know if it says mitral in your book. It does. I don't know where it gets all these crazy names. I like bicuspid because it has 2 flaps, 2 cusps. It does the exact same job as this one, except it does on the left-hand side. It stops backflow of blood from the left ventricle back into the left atrium. The blood came from here, right? Logically, it went down. So when it comes down here, and this contracts, I don't want it to go back up there. And if there was a hole there, it would. So that closes. It does it by pressure. There's no switch on it that turns on the light or makes it move. It does it by pressure of the heart. Okay? Can you replace one of those? Yeah.
What's that one called? Sorry.
Left AV, left atrioventricular, bicuspid, or even mitral. They're the same. I could take a chunk of this one, if I was a good surgeon, could sew it over into this one. They're the same material, same stuff. They don't know any different. They're just where they're attached. Those 2 are the same. All right, the other 2 we have right here, easy to see, the pulmonary semilunar valve. Okay, it looks different, right? Semilunar, what? Moon, half moons. Semilunar. 1 little half moon, 2 little half moons, 3. So it also has 3 flaps, but they don't look like flaps. They look like little cusp or little half moons. So thus, semilunar valves. I've seen people with 2, and they're fine. They never knew it their whole life. She might have 2. It's fairly common to only have 2. I've never chopped open many human hearts. We always, before sheep, right? Most of them always have 3, but I bet there's a 2 in there once in a while. It's not uncommon. You can live. They just, instead of going 3, you got 2 on each side instead of 3. Okay? Where does it stop blood from back flowing? Look at the picture. You don't have to know anything about the heart.
I say back into the
From the left pulmonary artery back into the right ventricle. That's where it stops it. They all do this. They all stop backflow. So you see where it is. Now in the test, you're not going to have this picture. But blood, this contracts. Blood goes up. It pushes that valve open by pressure. When it stops and this pressure stops, it wants to go back downhill unless you're standing on your head. Nobody's doing that. So the blood's going to come back down. It's going to fill those little flaps up, and they're going to stick together and stop. Nice. Is something a little bit going to drain back in? You dang right it is. normal. Mine's perfect. I've seen mine. It doesn't drip in. But this valve stops blood backflow between the left, or not left, but just the pulmonary arteries, right and left, to the right ventricle. Okay? The other one, can't see it in the picture. Take your vision and imagine that one and stick it up in there. Stick it in the base of the aorta. Here's the aorta coming around, it goes underneath the pulmonary, and there's the piece of it right there. It looks exactly like that one. And it goes right there. Does the same thing. It stops backflow of blood from the aorta into the left ventricle. This one messes up a lot. I've known lots of people that have had problems there. You think it's a big problem? You want blood to backflow where it's going to go to your body, back into your left ventricle? No. Big problem. You might not notice this one. This one you're going to start, your heart's going to start enlarging. The vessel walls are going to get bigger. And it's getting pretty routine to sew a new one of those in there. They got metal ones now, they got titanium ones, they got ones from Talscan, they got all kind of cool. I'd rather pass and not do it, but people I know that had it are fine. They help. We'll talk more about that later. Aortic semilunar valve. Now the problem in your book, a lot of times you get lazy and you start saying pulmonary valve. That's the one they're talking about. They say aortic valve. That's the one they're talking about. I like to put the word semilunar in there because I don't get confused. You start telling me aortic valve, I start thinking maybe, oh, that might be that one. So I like to use the whole name. But in your book, and doctors, they don't. I've never heard a doctor at the hospital say pulmonary semilunar valve. They say pulmonary valve. And they're talking about that. Okay, that's the only 4 valves you've got. And every mammal has those same 4. If you're a reptile, you don't have those, but that's for general biology. Okay, done with that. Let's go back to these valves down here and talk about these guys. Now this is where you start naming your kids. I tell you, people, name your animals and your kids. Think about this name to come to dinner. Hey, Corday. No, it's good. Corday Tendone. Corday Tendone Robertson. I didn't name my child.